There has been a flurry of Alzheimer's research published in 2023, and multiple papers recently have elucidated causal mechanisms for Alzheimer's disease. One that has been suspected and intuited for a while, and then two others that are more recent and pretty intuitive if you've been in the space long enough. But overall, the research every day is putting the pieces together further and further towards understanding what causes Alzheimer's. And like all chronic diseases, there's not one individual cause. There's many causal factors, and what was the cause for Jane might be a completely different causal pathway than what the cause is for John. And so the more causal pathways we understand, the more we can look for, and the more we can work to prevent ahead of time. Because as my subheading says on this slide, the best way to treat Alzheimer's is to never develop it in the first place. If you're trying to reverse dementia once you're demented or failing the MMSE questionnaire, you're pretty far down the road. So the key is to take action early so that you never develop the dementia in the first place. And papers like the ones we'll cover today give you clearly actionable targets to pursue so that you are not one that the American Alzheimer's Association is predicting 1 in 3 adults will develop Alzheimer's disease. So if that were to happen, that would bankrupt the United States, and we would no longer be a country in the not too distant future. So we can't allow that to happen. And in case you're worried about that, I believe type 2 diabetes is supposed to bankrupt us before Alzheimer's anyway. So don't worry about it. Just kidding. So let's dive into this research and learn what causal mechanisms for Alzheimer's are and how to avoid those. So here we are on the first paper, and this paper is published in 2022 in the Archives of Gerontology and Geriatrics. So they're studying the elderly, is what this journal does. And so this journal is looking at Alzheimer's disease, and specifically this is a rat study, and what they did was they caused Alzheimer's in rats by exposing them to aluminum. Okay, and we'll get back to the rest of that in a minute, but it's important. The aluminum is important because the aluminum is the causal mechanism. And that's important to you and I because humans are exposed to aluminum all the time. Now, there's some in the health space, the public health space, that will say that aluminum is not dangerous, but those people are not correct because aluminum's been known as a neurotoxin for 100 years. And yes, it is a metal found in the environment, but it's found in food and medications like antacids. It's found in additives. It's found in our water supply. It's found in utensils that you eat off of. And probably for most people, or at least most people who aren't taking medications that contain it, deodorants, specifically antiperspirants, are the most common exposure to aluminum on a day-to-day basis. And then childhood vaccines are a huge exposure to aluminum as well. And Dr. Russell Blaylock, the neurosurgeon, has published multiple books and papers on aluminum toxicity caused by caused by childhood vaccines. And I discussed that in my book, The Autoimmune Answer. But deodorants and antiperspirants on a day-to-day basis are probably the most common exposure. Why would aluminum be in an antiperspirant deodorant? Because aluminum basically clogs your pores to keep you from perspiring. So that is the antiperspirant effect of the antiperspirant deodorant you're using. So yes, it keeps your armpits dry, but it also could promote things like Alzheimer's disease, which, I'd rather have sweaty armpits than Alzheimer's if we're having to choose one. So aluminum is a known neurotoxin. And since Alzheimer's is a neurodegenerative disease, we want to minimize our exposure to aluminum if we are trying not to have dementia. So you can see here, several studies confirm the association of aluminum levels in drinking water and dementia risk. An increase of aluminum level was reported previously in Alzheimer's disease brains on autopsy. In this context, aluminum causes a conformational change of beta amyloid protein, leading to increase in its aggregation. And beta amyloid plaques are, the pathognomonic sign of Alzheimer's disease. That when those things build up, that's what drives Alzheimer's. It was also shown that Alzheimer's induces the formation of neurofibrillary tangles in Alzheimer's brains. So again, aluminum is not good. We don't want to be exposed to it and have high levels, because it drives plaques, it drives oxidative stress, it drives inflammation, it drives brain damage. So then this paper goes on to say, okay, we cause Alzheimer's disease in rats. Are there natural things we can use to promote neuroprotection against the aluminum and against the Alzheimer's risk? And so this paper looked at vinpocetine and EGCG from green tea and CoQ10, vitamin E, selenium. And what they found was that vinpocetine and EGCG in combination were the most powerful, had the most powerful neuroprotective effects for the rats. Vinpocetine has been used for treatment of dementia and memory disturbances for a long time. It crosses the blood-brain barrier and has multiple functions, including antioxidant, anti-inflammatory, and vasodilation effects. And the vasodilatory effects are as important as the anti-inflammatory and antioxidant effects, because we need to deliver blood to the brain to nourish the neurons and keep them healthy. So if you've got, short-term memory problems, if you've got a lot of cognitive issues that could range from brain fog all the way to dementia, vinpocetine could potentially be useful, because it dilates these small vessels to deliver more blood to the brain tissue, which that blood is carrying nutrients, oxygen, glucose, all the things the brain needs. EGCG is the most abundant catechin flavonoid in green tea. Its function is as an anti-inflammatory and antioxidant. And again, a recent study showed in rats that EGCG can pass through the blood-brain barrier of cognitively impaired rats. So the CoQ10, the vitamin E, the selenium had effects, but not as powerful in this study as the combination of the vinpocetine and EGCG together. So at least in an aluminum-induced Alzheimer's model, those are two strategies that you'd like to leverage if battling or preventing Alzheimer's is your goal. Now, there's another study recently published looking at a similar thing. Again, they induce a rat model of Alzheimer's disease, and they looked at vinpocetine with cocoa this time. Excuse me. So what happened? So what they did was, again, they damaged the rat brains with aluminum. You can see up here. And the aluminum, what it did was it increased oxidative stress, it increased inflammation, it decreased the brain-derived neurotrophic factor, so it decreased the brain's ability, the neurons, to make synaptic connections and decrease cognitive function. So then when the researchers administered cocoa, either by itself or in combination with vinpocetine or EGCG, it, quote, demonstrated remarkable amelioration of all assessed parameters. Okay, so when the aluminum caused the inflammation and the oxidative stress and the decreased BDNF production, giving cocoa with vinpocetine or cocoa with EGCG eliminated all that. So it reversed the damage. That's pretty powerful. So the author said the combination of cocoa with nutraceuticals attenuated the Alzheimer's disease mediated deterioration by modulating the interrelated pathophysiologic pathways. So that's really powerful, because if you go online and read anything about Alzheimer's treatment, you're going to see that it says there's no treatment today that's proven to do anything, right, long term and stop the disease. And so again, if we can use something as simple as natural nutrient and dietary source things to prevent the disease that prevent the damage that aluminum causes that can result in Alzheimer's, then we could potentially avoid Alzheimer's. So pretty powerful stuff. That is looking at the aluminum causal mechanism in Alzheimer's. Next, we want to look at the gut. Does the gut microbiome play a role in Alzheimer's disease risk? And yes, it does. Here's a paper from Brain that was published this year titled Microbiota from Alzheimer's Patients Induced Deficits in Cognition and Hippocampal Neurogenesis. So what this research did is it had humans with Alzheimer's disease and humans that were healthy, no Alzheimer's disease. And what they did was they did fecal microbiota transplants. So basically they took, microbiome from the human stool and they transplanted it into the gut of the mice and observed what happened. And what they found is when they transplanted the gut microbiome from the Alzheimer's humans into healthy adult rats, the healthy adult rats developed Alzheimer's disease. When they took the healthy gut microbiome from the healthy humans and put them in healthy adult rats, the healthy adult rats did not develop Alzheimer's disease. So that shows a causal mechanism of the microbiota. And we can read here, it says, the gut microbiota is an important susceptibility factor in Alzheimer's disease due to specific alterations in the gut microbiome of Alzheimer's patients. We transplanted fecal microbiota from Alzheimer's patients and age-matched healthy controls into microbiota depleted young adult rats. We found impairments in behaviors reliant on adult hippocampal neurogenesis, an essential process for certain memory functions and mood, resulting from Alzheimer's patient transplants. Notably, the severity of impairments correlated with clinical cognitive scores in donor patients. So the humans with Alzheimer's, the ones that had the worst symptoms, transplanting their gut microbiome into the healthy rats, those healthy rats developed worse Alzheimer's than the healthy rats that developed Alzheimer's from transplants from less severe Alzheimer's humans. I hope that makes sense. So the worse the human was, the worse the rat was that got that human's microbiome. Our findings reveal for the first time that Alzheimer's symptoms can be transferred to a healthy young organism via the gut microbiota, confirming a causal role of gut microbiota in Alzheimer's disease. Again, here's another causal mechanism, your gut health. If you've been reading blogs or been interested in your health for any amount of time, I'm sure you've read at least one that said, look at the gut is key. Well, here's another paper showing why. Okay, the gut is key because that's where the gut microbiome lives and because that's where 80% of your immune system lives. So those two systems, we could call them, have systemic effects. And so if you, again, have a family history of Alzheimer's or neurodegenerative disease, then rather than hoping you don't get it and then trying to reverse it when you do get the diagnosis, the best move is to take actions today to hopefully never develop it. And these papers give you those actions. The last two papers said avoid aluminum, don't use aluminum antiperspirants, don't eat off aluminum utensils, check your water for aluminum levels, avoid other sources of aluminum, right? This paper says your gut health is very important, specifically of your gut microbiome. So we want to promote healthy gut microbiome. Well, what destroys the gut microbiome? Antibiotics, alcohol, processed foods, glyphosate, stress, all kinds of different things. So again, it's going to be a lifestyle approach to prevent the development of dementia. And they'll never stop it with a medication because there's no medication that can address the gut microbiome and aluminum exposure and the next thing that we're going to look at. So, the answer to chronic disease is not more blockbuster drugs. The answer to chronic disease is to not develop it, and you don't develop it by learning about what an ideal lifestyle is for you and then living that. So this paper was big time. They show it for the first time that it's a causal mechanism, but this could have been intuited because there's been other studies on fecal microbiota transplants in humans with Crohn's and ulcerative colitis, and you take the stool sample from a healthy human gut and give it to a human with Crohn's disease and drastically reduce their symptoms and maybe even cure in some instances. So the precedence was set, and now we're seeing it and Alzheimer's as well. So that is awesome. And then the last recent paper here was looking at the role of Candida albicans and Alzheimer's risk. And so Candida is a fungus or a yeast. Candida albicans is a very common fungal or yeast infection in humans. And this paper lays out how Candida promote increased beta amyloid formation, which are the plaques that build up in Alzheimer's. And a healthy immune system in the brain can modulate Candida levels and keep them at bay and take care of the beta amyloid, but an unhealthy immune system cannot. And so not taking care of the Candida like our brain should can lead to Alzheimer's disease. So there's a picture of it, but basically if we jump down to the introduction here, we'll just look at a couple things. Quote, environmental and commensal fungi. So environmental fungi are, fungi out in the environment when you're walking around that we're exposed to. Commensal fungi, or fungi, however you want to say it, those are fungal species that are in us and on us all the time. Whether they're pathologic or pathogenic or behaving depends on our immune system's relationship to them and our other microbes' relationship to them. So two people could have, so I could have Candida on my skin and the person next to me could have it on their skin. And if my immune system and skin microbiome are dealing with the Candida in a favorable way, then I have no symptoms, whereas the person next to me may have athlete's foot or may have some kind of skin rash or some other symptoms, or a UTI with Candida, or a gut infection with Candida, or a brain infection with Candida that leads to Alzheimer's potentially. So commensal means they're always there. And if one person's having a negative outcome and I'm not, then is it the Candida or is it that person's ability to respond appropriately via their immune system and or microbiota? All right, so these fungi are increasingly recognized as key drivers of diverse chronic inflammatory disorders, including asthma, chronic rhinosinusitis, so sinus infections, chronic pulmonary aspergillosis, eczema, and other itchy skin issues, vaginosis, and colitis. Only a few hundred distinct fungal species are pathogenic for humans, with Candida being one of the most common fungal pathogens causing diverse infections. Candida albicans, together with other closely related Candida species that are pathogenic for humans, is a commensal member of the human microbiota, but produces often serious opportunistic mucosal and bloodborne infections, especially in the context of immune deficiencies. So again, this is one that is a commensal member of the human microbiome. When it becomes an issue is when our immune system is deficient or our immune relationship to it takes a hit. A common example is, if you're immune deficient in the hospital, sepsis increases risk factor for Candida issues. Candida has also been detected in the brains of subjects with Alzheimer's disease and other chronic neurodegenerative disorders that lack obvious features of acute illness, such as fever, rapid onset of altered mental status, headache, and leukocytosis. Fungi are recognized immunologically by receptors present on the innate immune cells like neutrophils, macrophages, dendritic cells. Candida is specifically recognized through detection of the secreted peptide toxin candidialysin that it produces, and it drives an antifungal Th2 and Th17 immune response. So we've talked about these a lot. Okay, so if you can't mount an appropriate Th2 or Th17 response, then that Candida can persist, and what should be commensal now becomes pathogenic. So we'll skip a lot of the minutia for you, but I want to jump down to the bottom here because it's really important at the end what they say here. So two things. A, in this study, we showed that Candida saps are enzymes that the Candida albicans produces. So I'll just say enzymes. So we show that Candida albicans enzymes mediate entry of Candida from the blood into the brain by making the blood-brain barrier leaky. Following this pathologic event, your brain immune cells called microglia recognize increased beta amyloid peptides that are created by the enzymes released by the Candida albicans and their effect on the precursor to the beta amyloid protein. Okay, so what happens is Candida breaks down your blood-brain barrier, goes in and converts the beta amyloid precursor into beta amyloid, and beta amyloid is what drives those plaque buildup, drive Alzheimer's. So in a normal healthy brain, those microglia can break down the Candida, break down the beta amyloid and take care of things. But if it's not healthy, that's where the issue comes in. So here we go. Notwithstanding the effectiveness of the inborn immune mechanisms shown here in a healthy brain, the dominant role that Candida plays in determining effective human immune responses against diverse fungi, the critical unresolved paradox of Candida albicans infections is the ability of the fungus to persist in vivo in the body despite the existence of robust sterilizing immune responses at sites such as the brain and elsewhere. In vivo persistence of Candida albicans in the brain could result from immune senescence, so the decay of the immune system with aging. So the Candida could stay in the brain because the elderly person's immune system is broken down and can't stay on top of it anymore. It could persist because of reactivation of infection from a dormant state or a privileged site that prevents immune detection, or frequent reinfection due to the ubiquity of Candida in all human populations. And they say, and likely all three of these mechanisms are involved. So that was a lot, but basically what they're saying is, okay, healthy brain immune system will take care of it, break it down. You have Candida, but you won't develop Alzheimer's because the brain immune system is doing its job. Where it becomes the issue is when the brain immune system becomes senescent or breaks down over time with aging. Or, there is normal senescence of the immune system with age, but then the more unhealthy we are as we age, or our lifestyle is as we age, the faster we can speed that immune breakdown, and the faster that Candida is no longer kept in check and now promoting buildup of beta amyloid and dementia type symptoms. So our action from this study is threefold. A, we want to promote a healthy, robust immune system for as long as we can. We want to prevent reactivation of infection, which again, having a healthy immune system does that. And then we want to avoid reinfection. So all three of those different ways really have one solution. That's promoting an optimal immune surveillance and optimal blood-brain barrier integrity so that Candida doesn't get in the first place, if we can help that. So immune system health is going to be key for this mechanism, immune surveillance and clearance of the beta amyloid that the Candida is promoting and keeping the Candida levels in check overall. So to wrap it up, if you are someone with a family history of Alzheimer's or neurodegeneration, but specifically Alzheimer's, then these 4 studies are showing us 3 different causal mechanisms that are actionable. If you go online and read about Alzheimer's, the prevailing thought is that Alzheimer's is due to beta amyloid that is produced endogenously in our own brains by our own body. These new studies are saying that may be one mechanism, but that's not the only mechanism. And here's 3 mechanisms that are likely and that are actionable via lifestyle, immune support, nutrition, and avoiding environmental toxins. So this gives you hope rather than saying, oh, it's just something your brain's making and there's nothing you can do about it. That answer usually is proven wrong over time, and these studies are starting to do that for Alzheimer's. So take heart with this information, and remember the key is to not wait until you have a diagnosis before you take action. You want to live in a way that prevents you from ever developing the disease in the first place.